Disparities in healthcare have really risen, I think, to the forefront as we look at COVID and what has happened. So again,
People with
how
the
do we
exact same
not
access to same care, and yet the outcome in terms of mortality rates based on background?
So I would just say to begin with, part of it is just confusion in navigating the system. I mean, it's confusing for me to try to go find a physician if, I need primary care help or whatever it is.
And I would add to that technology and innovation absolutely could help in that space.
I think we haven't done a very good job of educating people about what's available now. May technology and help, I think so, but I think we need to find better ways to find physicians that they may need. We need to do a lot better at educating the public about preventive medicine, be it physical or mental. And I think if you look at this whole mess related to vaccination, I think the rollout in terms of politicizing it was one thing, but I don't think the medical community did a very good job of providing confidence in what they spoke about.
How do we help people understand this is very appropriate for a virtual visit or a telehealth visit, and these are things that really you should be seen in person for. So helping them kind of choose the path or navigating, as Jeff mentioned earlier.
The AMA during the most recent meeting, they voted to recognize that your bandwidth is now a social determinant of health.
The surprise billing issues that are being brought up across the country are really critically important. And I think you can't dictate what someone's going to charge for something, but you certainly can point out to patients that they have a choice.
Some of these extraneous bills come from repeat studies that might not be necessary because physicians have a hard time getting access to records or imaging studies that might be in different health systems or different institutions. And so there are issues with information transfer and imaging sharing that also tie into all of this.
On implicit bias, why are some folks getting better care and having less death rates, et cetera, than minorities and others? And what is playing a part in that?
Everybody's coming in essentially as emergency care, like it's insurance agnostic.